talking about sundowning and sleep issues as a dementia caregiver. So we are going to talk about changes that happen in the person that we love or we might be working with and how that affects their sleep, their circadian rhythm, but also this phenomenon called sundowning. That is a very common expression that people with dementia have. So we'll understand maybe the causes of, the why behind both sleep issues and sundowning. And then we're going to talk about the best tips to manage that. But we're also going to look at tips of how do I, as a care partner, manage maybe my sleep challenges that come along with this and maybe some restlessness or agitation that I have as well as that care partner. So looking at it from really both perspectives as the care partner or caregiver and the care receiver. But before we do that, just quickly, a little bit about James L. West. We are a nonprofit community located here in Fort Worth, Texas. We provide a variety of services all around serving persons impacted by dementia, whether that is through our free education that you're getting today. This is our gift back to the community. We also have long-term care community here in Fort Worth. We do dementia-specific rehab, and we also have a day program here in Fort Worth. Happy to provide any information on our other services that we provide. Just let me know, and we'll get you what you need. Today, this is information about our CE credits and our objectives. So the first part of today, we're going to talk about sleep disturbances and sleep issues, what causes them, best manage or even prevent sleep issues. The second half, we're going to talk about sundowning, what it is, what are the causes, risk factors, and best ways to maybe intervene or possibly prevent sundowning expressions. I'm hoping to leave enough time at the end to answer any questions. So I ask that you please, if you have questions throughout, please go ahead and drop those into chat, and I will get to those at the very end and allow time for questions or clarification, or if anybody wants to share anything as well. But I love this. Let's start out with this. I finally got 8 hours of sleep. It took me 3 days to do it, but I finally got through 8 hours of sleep. And I don't know if anybody can identify with that or how true that is for you or how true that is for your loved one. But like I mentioned earlier, sleep challenges and sundowning are common issues that happen in persons with dementia. And of course, when somebody has sleep issues or sundowning, they're also common issues for those that care for them and love them, because it affects us as well, particularly sleep disturbances. They're very common. Most of the time when somebody has a sleep disturbance or a sleep issue, it happens in the middle to later stages of the disease. That's the most common, but it can happen at any stage. We're going to talk a little bit about specifically dementia with the Lewy bodies, because that particular type of dementia does have more sleep challenges that come along with it. And those sleep challenges come along earlier in the disease state. It actually can be one of the warning signs. But it says, according to the National Library of Medicine, approximately 1/4 of adults with dementia experience sleep issues. So it's very common. And again, sleep, we're providing care for somebody that has a sleep issue. Usually means we are also going to have a sleep issue because our sleep's going to be disrupted and disturbed as well. And I will say sleep disturbances can be caused by sundowning, and sundowning can be a cause of sleep disturbances. So you will see over the next hour some of the causes for both sleep disturbances and sundowning, and to prevent and manage them are going to be fairly similar because they can both cause each other. But let's take a break or start off with understanding, all right, here's the brain. Here's somebody you see on the left-hand side, a healthy brain. This is a 3-pound brain. It's your brain. It's my brain. On the right-hand side, it says severe Alzheimer's disease, but anybody with severe or late-stage dementia, there are changes that are happening. There are chemical changes that are happening. There are permanent structural changes that are happening. And our brain controls everything that we do, including controlling our sleep, how we go to sleep, staying asleep, our circadian rhythm, or that sleep clock that we're on. And it also controls how we take in our environment, how we understand changes in the day, how we understand what's going on around us. And this is all going to play into sleep challenges, but it's also going to play into sundowning as well. And there is a particularly with sleep disturbances, there's a loss of neuronal tissue or neuronal pathways. And that loss, particularly in areas that initiate sleep and maintain sleep. Our brain initiates, kind of starts to shut down and puts us into our sleep mode. So that our brain does that, and there's a change. As dementia changes, that can change, but also our ability to stay asleep and maintain sleep for hours at a time. That's going to change with the changes that are happening in the brain. There's also what they call the maker or their circadian rhythm of our bodies. We've seen that. You've heard that term potentially, but their circadian rhythm or sleep-wake cycle that happens can be affected or will more than likely be affected because of the changes that are happening to the neurons and the neuronal pathways, but also in our brainstem that helps regulate our sleep-wake cycle is also going to be affected. So really just looking at this and understanding there's kind of a lot of steps to sleep, and how our brain does it, how our brain shuts down, puts us into sleep, stays asleep, goes through certain sleep, the sleep cycles that we have to go into, and then how it wakes us up and being on this sleep-wake cycle. Are we sleepy when we're during night? Are we sleepy during the day? The drowsiness, all of this stuff is all controlled by the brain. And as we have changes caused by dementia, both chemical and physical structural changes, that's really going to affect these sleep disturbances. And I say this because our loved ones or the people that we're working with aren't, they're having challenges with the sleep disturbances on stuff that they cannot control. Also, just a normal part of getting older, our sleep patterns change. It's common, whether we have dementia or not, or live with other chronic illnesses, our sleep patterns changes because of the changes that are happening as a normal result of aging. But there are also other factors that can play into sleep disturbances that we're going to discuss as well, because it's not always just dementia that's causing sleep disturbances, but it can be a huge part of it. But let's think about for a minute when we have sleep deprivation or we're not getting enough hours of sleep at night, because it really does cause safety concerns, particularly if it's for a prolonged period, we're not getting sleep and we're deprived of this vital, basic life function. It can be a safety concern, not just for the person that's not getting sleep, but also those of us that are providing that care. And I want you to think back to a time in your life, maybe it's current, maybe a past time, where you have not gotten a lot of sleep. And let's think about how that really did affect us. So were you more confused about things? You have more brain fog, harder to get through tasks during the day. Maybe you had more irritable or were more irritable or more easily agitated. We're not able to reason things, to do things. Our errors in judgment can have more errors in judgment. And we might see this in just decisions that we make, risks that we take. And I say risks that we take, it could be driving in the car. We're not really paying attention as much. We're too tired. So we might have more risky behavior, unsafe behavior, I should say. But it's also easier for us, particularly in areas of judgment, to not do what we know we're supposed to be doing, like exercising and eating well. Because if I'm tired and exhausted, it's hard to motivate myself to get up and go for that walk. What also happens is it just changes some hormonal levels in our brain. So our brain, when we have sleep deprivation or sleep deprived, our brain craves more sugars and sweets and salt. So it craves more of these unhealthy choices, diet choices. And when it craves, it's so much harder for us to resist these unhealthy choices. It also does something to our the hormone that causes us to feel full. So we don't feel full as much. So we might be eating a lot more because the hormonal changes that are happening. We can't fight off illness as well. There are some studies that show even just a half a night's sleep loss can cut our immune system in half. So we're much more prone to getting sick and staying sick longer. So we're not able to recover as well. It also increases our prevalence of depression, anxiety, of course, agitation and irritableness. And then we have inflammation in the body. For us as a care partner, these are not good things. But when you introduce dementia onto that as well, these are not good things. But it also has been shown to increase the severity or worsening of dementia. Just like we get worse when we don't get enough sleep, or persons with dementia will get worse, and they can progress faster in the disease state if they have prolonged periods of sleep deprivation. So again, this is a safety concern for both parties. And typically, if we're thinking about it, the person with dementia, some typical sleep disturbances that we come across is they may sleep too much. So they're sleeping up to 16 hours a day. Now, let me take a little kind of caveat to this. Persons in the later stage of dementia will start to sleep more. And this is expected, and it's a normal progression of the disease state. So let's think about where a person is in the disease state. If they're in the later stages, it's expected and it's normal part of the disease for them to sleep much more throughout the day. Throughout the day and the night. So they might be just asleep more often during the night, but also during the day, they're asleep more often, and that is okay. But we also might come across somebody that sleeps a lot less than they should be. They're only sleeping a couple of hours at night. We might notice that they're sleeping during the day and they're awake at night. So those a day staying awake in the night are reversed. Okay, that pattern is reversed, and that can be very common. And that can really affect caregivers as we're sleeping at night, and we can't sleep during the day, and we can't sleep during the night because our loved one's up, so we're not getting sleep at all, right? They might wander during the night, so there's some safety concerns. They get up a lot during the night to go to the restroom, more than what you would think is normal or what has been normal for them in the past. They may want to go to bed. When they go to bed, they want to keep on all their clothes, including the shoes. But they also might experience vivid dreams. So they have a lot more dreams. They're acting out their dreams, and they may not be able to distinguish the dreams they have from when they're awake. So a dream that they have, they might think has really happened. So that can be frightening. It can be confusing. It can be upsetting for them. And then I mentioned earlier, we'll talk more about this, but if they're diagnosed with Lewy body dementia, that is much more common. Sleep disturbances are much more common in that type of dementia. But causes of these sleep disturbances. So we're going to go through these. We saw the picture of the brain. We know that the brain is regulating or how it promotes sleep or initiates sleep, how we maintain and stay asleep, but also that sleep-wake cycle, the circadian rhythm. But it can also be they're just confused about the time, disoriented. Time doesn't really mean much to persons with dementia. 5 minutes for us may seem like 5 hours for them. So time really can be thrown out, and that can be very confusing, particularly if they're getting their days and nights confused. I mentioned later stage disease dementia, they will start to sleep more often. But some other factors that are not directly related to dementia. They might live or have another chronic illness that does affect sleep that you might already know about. Cardiovascular disease is one of them. People that have cardiovascular issues, heart failure, they do have sleep disturbances or sleep challenges come along with that particular illness. If they have a sleep disorder, like restless leg syndrome, sleep apnea, insomnia, of course, those are going to contribute to sleep disturbances. A urinary tract infection, UTI, will contribute to sleep disturbances as well. But also looking at the psychological illnesses like anxiety, depression, and stress. I'm going to go off on a little soapbox over here and say, I think for most people, depression, anxiety, and stress is a major cause of sleep disturbances for both the caregiver and the care receiver. But depression and anxiety and managing stress levels can be managed, right? We may not be able to take away depression or anxiety, but we can manage those levels, which can help with sleep changes. Of course, if there's pain, whether it's chronic pain like arthritis, or it's an acute pain that we may not be aware of, the sort of the body clock, the circadian rhythms, it's imbalance of those chemicals, And then if there's a medication side effect, medications can cause the side effects of not being able to sleep well. Lifestyle and activity choices. So if we're not getting enough exercise or our loved one's not getting enough exercise throughout the day, then it's hard for them to burn off that energy or burn off that restlessness. And the body just does not sleep well if it doesn't expend the energy during the day. Our diet can contribute to a lack of sleep disturbances. You know, how much processed food, how much caffeine are we eating, upsetting foods, are we constipated, or we have heartburn, are we just uncomfortable and bloated all the time? Because that obviously can contribute to being uncomfortable and in pain and not being able to sleep. Boredom and restlessness. If somebody, this kind of goes along with lack of exercise, but if I'm not doing very much throughout the day physically, but also mentally or socially, it is so hard for me to really get good, deep sleep. Or I might go to sleep for a short period of time, but then I'm wide awake or I'm up because I haven't expended, like I mentioned, physical energy. I haven't metabolized out this energy that we produce every day. But I also mentally might not be challenged. And so my mind might be awake. Now, for us that are caregivers, our mind might not be able to shut down. So there's the opposite side of that, right? I just can't shut down. I want to, but I can't get it to stop. So the change in a routine, any change in a routine or in the environment can cause just more confusion, more agitation or uneasiness, maybe even more fear in somebody with dementia. And when we have that, the heightened anxiety, heightened uncomfortableness, it can disrupt our sleep. And then we're going to talk about our sleep hygiene and what that means and how we can have a better sleep hygiene. But alcohol and too much napping. So these kind of have a couple of caveats with those. Some people use alcohol. Some people abuse alcohol, but if you're using alcohol or what you might call a nightcap to promote sleepiness, it does promote sleepiness because it is a depressant, right? So it does make us drowsy, but alcohol prevents us from going into the sleep cycles that we need to go into. So we might go to sleep, but it stops the brain from getting into the quality sleep that it needs. So we're not getting the right kind of sleep that we need. So we're going to wake up and be drowsy and still have some sleep deprivation because the brain didn't go through the certain cycles that it has to go through because alcohol prevents that process. And now too much napping, and we'll talk a little bit more about that because there's kind of a fine line between napping and then too much napping and what's the right amount, because napping can be encouraged, but we don't want to over nap to where it just disrupts our sleep at night. But we'll talk more about that in a second. But then there's the environment. The environment plays a huge part into persons with dementia, how they're taking in their room or their environment that's around them. Is it familiar? Is it a safe place for them? But is it comfortable? And if you think about yourself, what do you need to go to sleep? Are there certain things that you need? I have to have white noise going. I need to make sure it's completely dark in that room, and it needs to be a little bit cold. You know, those certain things really help promote sleep for me. And really across the board, that's the best for most people, right? So are we creating an environment that promotes sleep and helps maintain sleep? So do we have it at the right temperature? Do we have too much stimulation going on? Is there a TV in the room and they fall asleep watching TV? Or they fall asleep with noise, like stimulating noise, like the news is on, or they're listening to talk radio or something? Are they uncomfortable? Is the mattress really old? Are the sheets piling, filling, and they're not comfortable? Is it too hot? Is it too cold? What is the light that's coming in? So there's a lot of factors into our environment, and we'll dive more into some details about that, but it can impact our sleep and the quality of sleep that we're getting. Quickly about dementia with Lewy bodies that I mentioned, because this sleep disturbances is a common part of this particular type of dementia. It can be a warning sign for somebody that has dementia, but a common sign for them is that they do start to have, they might already have a sleep disorder like restless leg syndrome or sleep apnea, but they also start to potentially start acting out their dreams. So when they're asleep, they're much more active than they used to be. So they might talk in their sleep. They really are physically moving, acting out the dreams that they have. They can have more upsetting dreams or more nightmares than they would have in the past. Talks about the periodic limb movements. So this is acting out the dream, but what is happening is that there's a certain cycle in our sleep that paralyzes our body. That's part of our sleep and the importance of sleep that it does. It paralyzes our muscles to move. So, but that can be disrupted because of the dementia, Lewy body dementia. So as the dream comes up, our body, the paralyzed part, is not being enacted. And so it starts to move around, which can disrupt the sleep for that person. But if you're lying in bed next to them, it's disrupting your sleep as well. And then I mentioned having a hard time separating the dream from what's really going on when they wake up. And particularly if it's a nightmare, if it's an upsetting dream, and we would be unable to reason with them about that. Well, you dreamt that and this is not happening. Oh, don't worry about it. It's just going to be too muddled. So that can raise anxiety levels and agitation levels. And then they might notice that there's excessive drowsiness during the day partly because of the sleep disturbances, but also because of just part of the dementia and one of those symptoms for that. So best tips for managing sleep. Okay. We want to make sure there's not, unfortunately, a black and white answer on how do we help people with their sleep disturbances, or there's not one thing we can do to make sure that we fix all sleep disturbances and now they're sleeping through the night, and when they're awake during the day, we're up and excited and we're not drowsy. It's really a variety of things that we need to do. And the first one is to rule out or treat any other factor or cause that might be causing the sleep. So we want to make sure they've been treated, particularly for an acute illness. So if this is a sudden change, all of a sudden they're having a hard time with their sleep, we need to get in. We need to have a UTI test done on them. We need to have the doctor kind of do a full, just kind of wellness check on them, see what's going on, if there's any acute or sudden cause that would be causing the sleep disturbance. Maybe there's a sleep disorder that's not been diagnosed or not being managed well that they already have. But also look into, okay, so what do we eat for dinner? Is their acid reflux just flared up? What about pain that they're living with? Is their arthritis flaring up? Kind of ruling out all of these other things, illness-wise, that we can go ahead and treat, and hopefully that will help the sleep disturbance, or maybe really get it to go away, if that's the main only cause. But we also want to look, of course, at medication side effects. And this can be a new medication that somebody has, but also look at all the medications that they're taking, because some people can feel the side effects of a medication, even though they've been taking them for years, months at a time. A side effect might kind of poke its head up. So we want to look at all that. And then look at their, I'll come back to history and habits, but we talked about physical pain, but also let's think about anxiety, depression, and stress. What is the environment? Is it a stress-free environment? The environment that we have for them, particularly when it talks about bedtime and sleep, is it friendly, and is it familiar? Is it a place that they would want to be in, that they recognize and that they feel safe and comfortable in? Increase the movement throughout the day, watch the diet. And sometimes you might need to keep a diary about some of these things, like a food diary, just to kind of see, well, is it certain foods that are setting them off? Are they something causing them constipation? What's going on here? Really just to help us find a theme in all of these things. But also think about their sleep history and their habits. If they have always gone to bed late at night, or particularly maybe back in their, late adulthood or early adulthood, if they were night people and they were up late at night, and they might have slept in or had the opportunity to sleep in during the day, we might need to think about their history of those sleep habits. Because right now, are we putting them on our sleep schedule where it is bedtime at 8 o'clock and we're getting up at 6? Because that works best for my schedule. When for them, that may not work for them. Some people just have a natural circadian rhythm that they fall into, and some people are more night owls, and some people are more early birds. And we have to kind of think about, well, what was that? And do I need to go back in time, or maybe they are at, as they regress in time, what were their sleep habits back in their past? Because I might need to adjust their routine to what those sleep habits were, from their history. So we do want to make sure, I really can't stress this enough, but exercise throughout the day. Not only does exercise help burn the energy, but it also helps reduce symptoms of depression and anxiety. So you can kind of kill two birds with one stone, right? With that. And you don't have to do a whole bunch of, you don't have to go walk 12 miles or anything like that, but it's just getting daily movement. And if you can get movement throughout the day, that's even better. Okay. One tip, and this is part of a sleep hygiene we're going to talk about, but if you can get outside and if you can get sun, ideally, if we can go outside and get the natural sun, it helps soak into our skin. We get that vitamin D. The sunlight also, if we get it in the morning, really right after we wake up, about 30 minutes to an hour, getting that sunlight is going to help our brain and our bodies start that circadian clock. So that body clock starts to tick down and say, okay, I'm awake. And so it starts its clock, the body's clock, to tick down to where when it becomes evening, nighttime, the body starts to get tired and it gets into its system that it needs to go into promoting sleep, initiating sleep, staying asleep. So the sun does help with kickstarting that body clock that we need to have. I talked about diet. I've mentioned alcohol, nightcaps. The alcohol prevents the brain from going into certain cycles, but also watching caffeine. So what's the caffeine in the food that we eat also? It might just, we cut off coffee at 11 o'clock, but what is the hidden caffeine in other drinks and food that we eat too? And of course, the environment. Generally, colder temperatures help promote sleep for most people, but also asking ourselves, well, how old is that mattress on that bed? Is the blanket comfortable? You can get weighted blankets. For some people really like the comfort of the weighted blanket. There are different weights on each blanket, but that weight can be very comforting and calming for a lot of people. So that might be something to look into. You can get a full-size blanket. You can also just get a lap blanket as well. So it's just putting on part of the body, but that weight can be very helpful and can help calm and soothe. I've talked about it, the room being familiar and friendly and workable. So it needs to be items from their past. Typically, a lot of times we want to decorate, mom or dad's room or a spouse's room with all the grandkids, pictures and all that. But to them, are those familiar people? Do we need to go back and put pictures up of when they were kids and stuff from their past that can be familiar and friendly for them? What's the light? What's the noise? A couple of things I will say about light. Light tricks our brain to staying awake. So this is any kind of light. So this is good. When we want to get up, we want to make sure there's plenty of light, particularly sunlight. So the brain sees it and the brain says, okay, I'm supposed to be awake. But if it's nighttime or I'm trying to promote sleep, light from a TV, from a phone, from a Kindle, those things, though that light tricks the brain in staying awake. Once that light goes off, it typically takes the brain about 30 to 45 minutes to start shutting down and going into its sleep mode. So we need to keep that in mind, not only for our person, but also for ourselves. If there are, I do want to catch, my favorite show before bed. Well, okay, but then it might take me 30 to 45 minutes just for my brain to not see that light anymore and keep me awake. So just some tips there. Let's turn the lights off earlier in the day. And that's what that is. So some other great tips for managing sleep hygiene is putting ourselves on a routine. We can train our brain from waking up if we do it on a routine. So we're waking up around the same time every day and going to sleep around the same time every day. I mentioned after you wake up, get some sunlight into your skin. Yes, the natural sun is the best, but if you need simulated sunlight, you can go on to Amazon. There's I think today's the last day of Prime Day, and you can get simulated sunlight. I have one in my office actually for when it's cloudy days, so I can have that simulated sunlight. I think it's called a Happy Light. I think it's a brand name, but there's different things that you can get to help simulate that. So you can even sit down. If your loved one is less mobile, you can put that light in front of them while you're eating breakfast. So the brain can be like, oh, this is sunlight. I'm getting this. Let me start that body clock clicker or ticker so it starts to click down from being awake to where it'll start to be tired and start promoting sleep in the evening time. We want to keep to those lifelong rituals, routines, but maybe we have to learn what was their lifelong or their rituals and routines from their past lives. We can also use aromatherapy. Lavender helps promote calmness and relaxation. So if we put that on in the early evening and just have that in the background part of it, it does help the body start to calm down. But then you can use the eucalyptus. Eucalyptus also helps promote sleep, but you can also use citrus scents in the morning to help us stay awake. So more energizing scents in the morning, more relaxing scents in the afternoon. I mentioned turning off those electronics, those lights. You can do touch as well. So soothing touch, whether it's a hand rub, foot rub, back rub, combing of the hair or brushing the hair. All of these patient calming touches will promote sleep and promote relaxation. So the body starts to put itself down into sleep mode. I mentioned naps. I'm going to go back to that. So the best thing about naps and what everybody, the science is saying, right, is that long naps, there's more of a cost if somebody has a long nap. And a long nap means 60 minutes or more, because a long nap can really disrupt sleep later on in the nighttime. But napping can be really good, particularly if we do have some sleep disturbances and we're not sleeping through the night, or they just get more tired throughout the day. And a nap can be really helpful for somebody with dementia to help them kind of relax, and then they wake up and they're kind of reset again. So, I like naps, but we do have to make sure that if we're napping, we just maybe do 1 or 2 throughout the day. And of course, this all depends on each person and each situation, but commonly, typically. And the nap needs to be no more than 30 to 60 minutes. If we're going over 60 minutes, that can really mess up with the circadian rhythm, and it can really mess up with the nighttime routine as well. Because if it's for longer than 60 minutes, the brain might think that it's nighttime and it's going to bed. So they may stay asleep longer. And then when it actually is bedtime, they're not tired and they're awake. So 30 to 60 minutes is the best practices. And really, if you just do it once, maybe twice a day, depends on the person, depends on the situation. So best tips for caregivers to get sleep when our loved ones, or if our loved ones are having a hard time with the sleep disturbances. Here are some best tips for us, because we also have to protect our sleep. And like I mentioned, there's not a one pill. We're going to try. It's a multi-pronged approach, or multi things that we need to try and start implementing. And it's going to take a while for these things to take effect too. So we're going to start we're waking up around the same time, going to bed around the same time. We're going to do the light as soon as we get up. We're going to start using aromatherapy. We're going to turn the lights off at least 30 minutes before we go to bed. So we're going to start implementing these best practices or good sleep hygiene practices throughout the day. But it's going to we have to be consistent about these practices, and it can take 30 to 60 days for us to notice a difference. So we have to give it enough time for it to actually start to work, because we are training. We can train our brains, but it does take a little while for our brains to get trained and to get back into a more normal routine. So as we're doing that, best tips for us as the caregivers is we've got to find different times to get rest too. So maybe we sleep. If our loved one is napping, we need to go take a nap when they're napping. Let's not try and fill that 30 minutes to an hour with all these little things that can wait if I need to get some sleep. Choosing your battles also. If they are not going to go to their bed when it's nighttime, if they'd rather sleep on the couch or in the chair, If they're going to go to sleep, then let them sleep on the couch or the chair. If we can't get them to take their pajamas or put their pajamas on, or take their clothes off, and it starts to become an ordeal and everybody's starting to get ramped up and it's nighttime, let's tap the brakes and say, it's okay. You can go to bed here. And then maybe after you're asleep, I'll come in and take your shoes off, if I'm afraid of not waking you up, because we kind of have to choose those battles. Really, a light meals and a dinner, of course, or at dinner time, avoid alcohol. And then if you are sleeping with them in the same room, but it's just kind of impossible for you to get a good night's sleep rest because they might be acting out their dreams, they might be getting up a lot to go to the bathroom, but they do come back to bed, it just wakes you up, then you really might want to think about sleeping into a different room. You can get a room monitor so you can hear them get up, but you don't have to get up as well. Install door alarms around the house if necessary, if they are up and wandering. Again, just because they're up doesn't mean I have to get up too, as long as I know that they're safe. Maybe I get up once and help redirect them back to their bed. But if they're just going to go back to sleep, and they're going to get up and wander, or they might go in there and watch TV or do what they're going to do, that doesn't mean I have to get up too. I just need to make sure they're safe. So I know a lot of families that use a room monitor that are sleeping in a different room, but they do know that the house is safe and secure. So we might have to kind of think about our sleeping situation too. Here are 3 great techniques to promote sleep, particularly for us caregivers. Of course, our loved ones can do these as well. But this is if we're lying in bed and I just cannot go to sleep, whether it's because I'm overly exhausted, my mind won't shut down, whatever it may be. Our progressive muscle relaxation, this is a systematic tensing and then relaxing of muscle groups. So you might be lying there and you go from head to toe or toe to head, but you might start at your toes and you flex your toes and you tense them for 3 seconds and then just release them, and you can feel the relaxation and the blood kind of relax throughout the body. And then it might be your ankles you tense, right? So you're tensing your ankles, hold that for a few seconds and then relax it. But as you're relaxing it, really pay attention to how it feels to relax those tense muscles. And then it might be your calf muscles, then your quads, then it's your stomach, then it's your arms. So you work your way up to your head to where it's in your face, and you tense your face, hold it, and then you relax it. And but really pay attention to the feel of that relaxation. It can be distracting if we can't shut our mind off, but it does it activates the body's relaxation response. There's also meditation. There's a variety of different ways to meditate, but it really focuses in our breathing in and out. You might focus on a word, mantra while you're doing that. But I'm going to sit here and I'm going to focus on my breath for this period of time. And again, it activates that body's relaxation response. And then guided imagery is a form of meditation, but this is where you are going to a place in your mind's eye. Okay, so you are going somewhere. It might be a past place you've been that you've really enjoyed, like the beach or the mountains, but you are hearing the sounds of the beach. You're feeling the sand between your fingers. You're feeling the sun to, warm up your skin. You're hearing the waves crash. You're smelling the salt air. So you're doing all of your senses and you take yourself there in your mind's eye. And that can be relaxing, and it really helps promote sleep. But I encourage you to use these techniques to help promote sleep before you start to use medications. Now, this is just, please know I'm not a doctor. This is just for information purposes only. So you always want to talk to a doctor whether you're going to use medications for yourself or for your loved one. But the best practices is to start low and go slow with any medication for you or your loved one. Be very aware of the side effects of medications that are prescribed. And also know that prescribed medications, we only want to use those for a period of time. They're not meant to go on a sleep medication and you stay on them for forever. They are meant to help you until you establish your own or your loved one's sleep routine. So it helps them get back on their own sleep routine, and then they can start to come off that medication. It just helps get you there, and then you come back off on it. Okay. But please talk to your doctor about that because sometimes that might be a necessity. But while you're doing that, well, we also want to make sure that you are, what just happened? Also practicing the non-pharmacological techniques, that progressive muscle relaxation and the meditation and the guided meditation. Sorry, my screen messed up. Let me reshare with you all. And then we're going to talk about sundowning. So like I mentioned earlier, right, sundowning can cause sleep disturbances, and sleep disturbances can cause sundowning. Okay, so some of the things we're going to talk about sundowning are going to be very familiar or similar to our sleep disturbances, or maintaining sleep disturbances. But sundowning is it's a phenomenon, and it's very common for persons in the more later stages of dementia, or excuse me, moderate, middle to later stages of dementia. But it's really a time of the day that somebody seems to be more confused, they're more agitated, they're more restless about things, they might have more anxiety. And typically the time of the day is late afternoon, early evening. It can happen at any time, but typically that's when it is. It's late afternoon, early evening, and my person is more confused than they have been throughout the day. They're much more agitated and restless. And there's a variety of reasons why we think this happens. And there's a variety of things that we can do to help relieve these symptoms. We may not make these symptoms go away completely or stop somebody sundowning completely, but we can help alleviate some of these symptoms. Okay. And on the screen here, you can see some symptoms that it looks like. They may actually hallucinate, hear or see things that hear or see things that are not there. Typically, it's not too upsetting. It's generally just like these, there's a bunch of kids back here in the back room and they were being so loud. We need to get them out of here. I got to get these damn kids out of here. Or they're seeing animals over in the corner or something. They might have be more aggressive or prone to aggression in the later afternoon or when they're sundowning, because they're not as in control of their emotions and they're more confused about stuff. They're just not as in control. So you also might see them pace back and forth. They might have more panic reactions to things. And you might notice that they're much harder to redirect during this time. Earlier in the day, I can redirect them or distract them a little bit easier, but now it is much harder for me to do that because really they're in a heightened state of anxiety and confusion. So this is just another example of signs and symptoms of sundowning that can happen. But what we think contributes to sundowning, we really don't know for sure, but there's a lot of things that we think contribute. Exhaustion is one of them. So let's think about this. It's later in the day, it's late afternoon, early evening. And I want you to ask yourself, when it's late afternoon, early evening, how are you feeling? For me, honestly, that's typically the time of the day that I am in a slump. Like, I've dropped off, because I've been working and doing all day long and that I kind of hit this wall, right? Particularly if I didn't eat well at lunch or I've had too much caffeine in the morning and I've really dropped off, but then I can rebound later on, or I can do things to help cope with my drop off. But that might be the same for our persons. It's just that time of the day we've been so busy and going and blowing all day, but now I'm tired and I need to rest. But they can't say logically or even know what to do to regulate their emotions or these feelings of tiredness. They might just become more agitated. So they're expressing their tiredness or exhaustion with agitation, more confusion, things like that. They can also have a harder time with eyesight, hearing stuff. It's also the time of the day where the term sundowning comes from, because that's the time of the day where the sun starts to go down. So there is a change in the environment. So the sun's going down and it changes. There's more shadows. There might be less light. It's just changing the environment. As well, so we need to make sure, okay, we need to come in and, well, what's the environment? Do we need to turn on more lights in the house? Do we need to make sure there's not shadows? Maybe we need to close the curtains. Maybe we need to keep them open. It depends on the person, right? And depends on the situation. It can also be a time of the day where there's a lot of noise and stimulation going on, because it can be, well, everybody's just come home from school and work, so there's a lot more people, there's a lot more action, a lot more movement going on, so there's more stimulation. Or if they're living in a community at some point, we've got more visitors, it's time for dinner, people are getting off work, they're coming to say hi to their loved ones. Or it also might be during shift change. For some people, shift change, there's people in and out, there's a lot of commotion going on, so there's just more stimulation and they're responding to that. But it's also a time of the day, let's think about it, it's a busy time of the day. We're getting off work, we got to go pick up the kids, we got to go make sure and get dinner started, we got to make sure and run these errands before we get home, we got to pay the bills, we need to get out there and take the trash out. We've got all of these things during this time of the day and responsibilities that they might be just reverting back and saying, I got stuff, I should be doing something, I've got important things to do, people are relying on me, I've got responsibilities, where are I got to go get the kids, I need to get home. So they might be reverting back to that time, and they really are looking, where's mom? That's a typical thing that we hear and see, is they're wanting to go home, or they got to go get the kids, or they're looking for mom or dad. Those are very common. But let's think about most of the times in our lives, I got to go get the kids, I got these chores to do. Or even if I'm reverting further back into my time, well, mom and dad, where's mom and dad? Okay. So they can be reacting to that, looking for familiarity, former obligations, I got to get to work, things like that. So let's have reasonable expectations about sundowning. And I mentioned this earlier, they may not be able to tell you or explain what's wrong or explain why they're upset or really agitated. They just really might be more confused, and they're less likely to stop the expressions or behaviors that they're doing in that time, because they might be so tired. And if you've ever been overly tired, you've ever been so tired you can't go to sleep, or you're so tired you're restless and you don't feel good, it could be that for them. Or they just can't, I'm so tired and I can't, or I'm so confused and have so much anxiety, I can't calm myself down, or I can't stop what I'm doing, I can't stop overreacting per se. So they're probably, I think that has a lot to do with sundowning during this time. So we need to manage our expectations. We may not be able to stop them from doing right then, but we can maybe alleviate some of those symptoms to make that part of the day easier for them, and in turn make it easier for us. And again, this is going to be a multi-pronged approach. So we're going to use a variety of different approaches to help, because it's not a do this and it's going to fix that. It's going to be a variety of things. And a lot of what is on the next few slides is what we've already talked about with sleep disturbances. What about the environment? Is it unfamiliar? Is it not friendly? Are there stuff in the environment that looks familiar to them, and it's their stuff that they can remember, pictures from their past? Or is it a change in the routine? A routine is very important for persons with dementia, but particularly if they're starting to sundown, because a routine provides comfort and familiarity. Not that they're going to remember, oh, it's 5 o'clock and it's time for us to start dinner. They don't remember those specific facts, right? But it's a familiarity, because this is normally what happens during this day. And I'm not thrown off by something spontaneous that happens. Most people do better on a routine. So if the routine has changed, that can cause them stress. Also, a lack of stimulation throughout the day. So if we're not providing them exercise, but also just cognitive stimulation, if they're bored, if they're sitting in front of the TV all day, that is boredom and loneliness. And then when the afternoon comes, they're really bored and their brain's going to go find something to do. When we're bored, the brain tells us we're going to go find something to do, whether it has dementia or not, or if there's a lot more people in the house, right? Now, well, now there's people here. Now we've got this energy and we've got this excitement, and they can just become overly excited, which to us might seem restless and agitated, but they also might be more confused. The routine is very important. In that routine, however, when you have more complex activities or stuff that you need to do that's outside of the house, most people, it's better if you do that in the earlier part of the day when they're better. So, particularly doctor's appointments, or if you're going to go do visits, or you still volunteer with something, if you go do those activities in the earlier part of the day, it's better for the person with dementia as opposed to later part of the day. But sometimes we can't always do that. The doctor's appointment might be in the late afternoon or after lunch. So you might see a change in the routine for that day. An example I have is we had a lady who brought her mother to our day program consistently, Monday through Friday, every day. She was a teacher. The daughter was a teacher. But when the summer came, the teacher daughter didn't work. So she stopped bringing her to the day program. And she called me, I remember, Miss Donna called me and said, my mom is really sundowning. She's becoming very agitated in the afternoon. She's starting to yell at me, kind of be verbally abusive in the afternoon. I don't understand what's going on. What is this change? So we talked through it, and I asked her a variety of questions, and I realized that she had not been taking her to the day program. Because I asked her, well, she liked that when she's at the day program. She's like, well, I haven't been taking her because I'm home now, and I feel guilty taking her to the day program because I'm at home. And if I'm at home, I should have her at home with me. But we talked through it, and I said, you've messed up her routine. Her routine was going to the day program and being a part of that community. And now that routine just kind of abruptly stopped. Well, I understand the guilt, but I think you need to take her back to the day program so we can get her back into her routine. And let's see if that sundowning and that verbal aggression goes away. So she started to bring her back to the day program. I don't think she did every day of the week, but she did at least 3 days. And that sundowning symptoms went away. So it's just an example of how important routines are, and we need to stick to them. But also creating those calming activities. The physical exercise just with sleep disturbances, physical exercise, movement throughout the day, physically, but also mentally and cognitively. Let's get them stimulated so they can feel purposeful. They are, they're grown adults who have had rich, fulfilling lives. They have had responsibilities, and people have relied on them. And we need to continue to give them those feelings. So we need to make sure that we put stuff in place that makes them feel purposeful, worthwhile, that we need them, that they're a part of our family and our community, and we've got to have this community. We need them to be part of the community. But of course, early activities when you start to see them sundowning, or if typically around 4:30 is when they start to become restless or anxious. Let's give them an activity that might be familiar to them and something easy. Something that's repetitive is the best, whether it's sorting nuts and bolts, whether it's pulling weeds, or it's folding clothes, or whatever it is. Something repetitive and easy can be one of the best activities during that time. For some people, and I've seen it more with men than women, but some people do better with physical activities as well. So I'm saying pull weeds, let's go for a walk. I know at our day program now, they're plastic, but it's axe throwing. And that really has helped a lot of our gentlemen that have sundowning during that time of the day, because physically they're getting out some of that aggression, but it's safe and it's fun and it's a competition, So things like that, something repetitive and something physical can be very helpful. But we also want to make sure that we're not preventing overstimulation. So is the environment overstimulating? Is there too much going on? Did we do too many naps throughout the day, or do they need a nap? So I mentioned this earlier, too many naps can really disrupt the nighttime sleep. But if they might need a nap, like after lunch, maybe an hour or two after lunch, right before the late afternoon comes on, a short nap, because that really can help the brain kind of stop, rest, and reset so they can come back with renewed energy, patience, less agitation, so they can do better for the rest of the part of the day. And we implement some of this nap time here at the West Center too. I can only imagine how tiring it is just to have the changes of dementia happening in the brain. But if we give them that opportunity to do that short, no more than 60 minutes nap, then they can come back and they generally can do better. And this is more just tips about the environment. We've talked about this. Make sure it's familiar, it's functional. They're able to work in their environment. You know, it's easy to maneuver around. They know if they're going to go get some tea in the late afternoon, they know, and they're still able to do that on their own. It's out there in a way that they can still do it. So, you know, they're able to work that environment. But we also need to make sure it's safe too. So there's some tips here on this slide about modifying the environment to make sure it's safe. We might need to limit shadows, and that can be turning on the lights in the house. It can be closing the blinds. But for some people, it might be we need all the blinds open so they can kind of see that it's dark outside. And we need to start kind of doing our wind down routine for the evening. It's different, you know, it's all different for each person, but these are some great tips on how to modify the environment. And then, of course, offer support and reassurance, particularly if they are hard to redirect. We want to use a calm voice. We don't want to panic. Okay, we don't need to argue with them. We use therapeutic stories as needed. If they're asking to go home, or if they're asking for their mom, or they need to go get their kids, we don't sit there and tell them, you are home. I am your kid. You're grown. I'm here taking care of you. You've got dementia. Go sit down and watch TV. That's not the best response, but it is meeting where they're at and say, oh gosh, you know what? Tell me a little bit more about your kids. Help me over here real quick, and then we'll go for a drive. It's meeting them where they're at. You know, one lady we had, let's see the time, she was just looking for, and she was so upset. She was looking for a mom. Her mom's, where's her mother? Where's her mother? Where's her mother? And I sat there and talked to her about her mother. And I validated her. So I said, oh, you sound like your mother was so great. And you go, oh, tell me, what's your favorite thing about your mother? How did she smell? What are all these things? Now, she cried the whole time and she kept asking for her mother, but she was able to talk to me about it. And for some people, mom is home. So they might be looking for their kids. They're really just kind of missing home, and what home is a feeling, right? And being able to talk about feelings and home and how that makes me feel, because home can be safe for some people, not all people, but home can be safe. But it's there allowing them to talk about it. Eventually, we were able to redirect her and have her to have dinner. She was sad still, but she was actually moving over and she was having dinner and she was moving out through the rest of the day. So again, it's kind of managing those expectations. We didn't stop her from being, you know, frankly upset, but she was able to talk about it and we were able to move her away from the door. And she wasn't agitated or aggressive anymore. She was just needing to talk about it. So I see that it is 12:31 and there are a few things in chat. I appreciate y'all staying a little bit over for those that you could. Let me read these chats really quick. The person is a night owl in their younger years, but not so much as their age does their sleep habits go back to their younger. Typically, more than likely, their sleep habits would go back to when they were younger in their time, because it's like they're kind of regressing back in their timeline. So if they were night owls when they were younger, then they're regressing back in their timeline to when they were younger. Typically, they might be more of a night owl. So sundowning is common in late afternoon, early, but if it happens in the morning or in the middle of the night. So the sundowning can happen at any time, yes. So a lot of the tips that we have in here are just as helpful, whether it's the middle of the night or if it's the morning. If it's the middle of the night, we can typically like show them, like open the curtains and say, hey, it's nighttime. Why don't we go back to bed for just a little bit before it's morning? We can maybe kind of redirect them and show them that it's nighttime, or show them that we can't go, it's not work time, right? If they're trying to go meet formal obligations, we still got to go to sleep. Work doesn't start for another 10 hours or, you know, whatever it is. But you can reverse some of those. So if somebody is not as good in the morning, or they're sleeping through the morning because they're up at night, then yeah, if the appointments are going to be later in the day, they might do better later in the day for sure. But the techniques that are in the slides and that we talked about would be just as useful, because with sundowning, we want to relax and calm them no matter what time of the day it is. Okay. So for the caregiver, do they adjust their schedule to the Sundowners patients, or do you just deal with it? I would stick to, first, over the caregiver adjusting your schedule. We might have to adjust our schedule a little bit, but I really would encourage you to go back to a normal, how can I train their brain, right, to go back to a normal schedule. But if it's, if they're up in the middle of the night, for instance, and they're sundowning in the middle of the night, we've implemented all the techniques that we thought to implement. We're redirecting them back to bed. I might need to adjust my schedule while we're in this stage of sundowning. And with all, but behavioral expressions, it is just a phase. Eventually that will go away. Something else can pop up, but eventually that will go away. And it might be that we need to adjust our schedule, but I also encourage you to, here's the sleep schedule that I want everybody to get on. It's going to take a while for us to do this. So for a while, I might need to adjust my schedule while I'm adjusting everybody's schedule to get back to the normal routine, if that makes sense. I hope that's helpful. But I appreciate this. I apologize, we went a few minutes over, but I will stay on if anybody has any other questions or wants to share anything. I will share this afternoon a copy of these slides. I will also share upcoming information. We did record this program. We are going to upload it to our YouTube channel in the next several days. And we invite you to come onto our future programs and our support groups as well. But if anybody has any other questions, please feel free to stay on, or you can log off. It's up to you. But I will stay on for a few minutes if anybody wants to share or ask a question. Heather asked if someone worked the night shift most of their life, they would stay awake all night. Yes. So we do. So the night shift, it's not a problem. It's just that routine. If they've always worked the night shift, then their days and nights are probably going to stay on their night shift days and nights. So we would have to adjust to that schedule, because we can't, if it was the majority of their life, then we would need to adjust to that schedule, knowing that they're going to be awake at night and sleep during the day. So we would have to adjust to that. Great point. When you upload this video, will the questions people ask be included? Yes, they will be. So we start it from the beginning and upload it up to the very end of the program. But if you have a question that you don't want on YouTube, please feel free to email me or call me, and we can talk at any time. If you go out of town with someone with dementia, how do you help them sleep in an unfamiliar place? That is a great question, because when you're out of town, you're not in your familiar environment, right? I would stick to routine as best you can as you're traveling. So stick to that routine as best you can. And then I would bring things that promote comfort and relaxation. So it might be a favorite blanket that you bring. It might be particular, song or noise, the aromatherapy that can help with that. So it's those other things, making sure that the room is comfortable. Look at the temperature. Is it dark in there? And if we're traveling, sometimes we don't get as much movement throughout the day too. So it might be, can I incorporate a little bit more movement throughout? It might be, we stop for a pit stop and we walk for a little while we're at the pit stop. So we are getting that movement, so we're tiring them out. But also travel can just be tiring, so that can be helpful too. But it is, can we bring something that provides familiarity and comfort to help promote that sleep? There is one thing, of course, it's melatonin that you can start to incorporate. Now, melatonin is an over-the-counter medication, so please, I'm not a doctor, I'm not a pharmacist, please talk to your doctor before you start to implement this or get their advice or prescription from them. But melatonin is a naturally occurring hormone that we have. As we get older, our body does not produce as much melatonin. So you can get melatonin over the counter, and it can help promote sleep and help you stay asleep longer. You absolutely have to talk to your doctor about that before, because it can interfere with other medications. And it's depending on the certain dosage that you take. You want to ask the doctor the dosage and the pharmacist how it might interfere with other medications, but that can be an option. It does take a while for the body to recognize it. So if it's something that you and your doctor agree to start incorporating, it can take about 30 to 60 days for you to start to notice the benefits of it. But that can be a more natural medication, if you will, to helping with sleep disturbances or sundowning too. Well, I appreciate y'all. Thank you so much for staying a few minutes after with me. The slides have a lot more information that I even got to cover, so please feel free to read those. A lot of great tips in there. And as always, if you have another question or something comes up, please feel free to always email us or call us. We're always available to talk, chat, email, anything. Thank y'all so much. We appreciate you being here.